Hey everyone, so today I'm just going to demonstrate a really quick skill. We've talked about using EpiPens as a treatment for anaphylaxis. This is what an EpiPen looks like. This is a trainer EpiPen, which means it doesn't actually have a needle in it. But this is what your typical EpiPen looks like, and typically they come in a pack of 2 because if you administer an EpiPen and that does not solve the problem or people do not start to recover quickly enough, then they will administer another dose of epinephrine. EpiPens can be very, very, very expensive, and that is why we try to avoid allergens, because not only is it a life-threatening disease, but just purely the cost of going through several EpiPens is very expensive. So to administer an EpiPen in first aid circumstances, administering the EpiPen should always be the first step, and then you should call 911. Anaphylaxis is a care first situation. You will hear that again later down the road when we take our first aid training course, but it's very important that you go ahead and administer this as quickly as possible. You always want to check and make sure that you have the right person's name and that it's in date before you administer it. Typically, most places do not have emergency EpiPens on hand, like hospitals do, and some doctors' offices, but like the YMCA where I used to work, they don't have these on hand. So that person is in charge of making sure they have their own EpiPen. In the school, I know that we do have at least one emergency EpiPen that we could administer if we absolutely had to, but it's really more important to use their EpiPen if at all possible. So in order to use an EpiPen, I'm going to take a step back here so that you can see. The first thing that you're going to do is you have to remove this cap. Okay, there's a blue cap on the back. You take that out. You take that off, okay? And the next thing you're going to do is you're going to take this and you're just going to jab it into the side of a person's leg. When you're administering the EpiPen, you may want to have them laying down or at least sitting down. And in some cases, especially with young children, you may want to have them even look away or like talk to them about something while you're administering this so they're not thinking about it. You do have to press pretty hard. If a person is wearing shorts or a skirt, you can just raise that up. If they're wearing jeans or long pants, you can just administer this through the pants, but you want to make sure you push hard so that you make sure it goes in all the way. Now, when you administer it, you're going to go for the side of the leg here because that's where we have a lot of muscle that's going to be able to disperse evenly. And you're going to make sure that you hold it in for at least 10 seconds so that all the medication is released. So you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you pull away, and then this thing will pop out to let you know that it has been used, okay? So there is a needle on the orange end and a cap on the blue end, okay? In most, you do not have to push on them, you just push it in, but on some of them, you do actually have to, here, I'm gonna demonstrate. On some of them, you actually have a button here, and so you actually have to put it in their leg and push on the button at the same time, but you should hear a click. If you can hear that, that's how you know. So you jab it in, 1, count 10, take it out. Okay, that is how you administer an EpiPen. Be very careful that you don't poke yourself with epinephrine if you're not the person having an allergic reaction. That is it. If you have any questions, feel free to ask me, and you can continue working on the rest of your assignments for today.